Assalamu alaikum. Welcome to this seminar. My name is Naomi. I'm the Assistant Secretary General at the Muslim Council of Britain, and I'm going to call on our Deputy to recite the Quran to begin, please.
Assalamu alaikum. Can you hear me? أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيها الذين آمنوا استعينوا بالصبر والصلاة إن الله مع الصابرين ولا تقولوا لمن يقتل في سبيل الله أموات بل أحياء ولكن لا تشعرون ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات وبشر الصابرين الذين إذا أصابتهم مصيبة قالوا إنا لله وإنا إليه راجعون أولئك عليهم صلوات من ربهم ورحمة وأولئك هم المهتدون صدق الله العظيم.
Thank you, Brother Masood. Of course, we know why we're here. Over the past 18 months, at least 50,000 Palestinians have been killed in Gaza. 12,000 have been killed since the 18th of March alone, and at least 15,000 of those killed are children. 180 of those children were killed in a single day. And we know that the death toll is likely much higher, as 61,000 more people remain unaccounted for. At least 90% of the population has been displaced, often multiple times. The healthcare system has been decimated. Over 1,000 healthcare workers have been killed, and over 2,000 journalists have been murdered. Critics asked why we as Muslims care so much about Palestine. Well, first of all, don't conflate anti-Zionism or support for Palestinian rights with anti-Semitism. We reject that completely. Our solidarity and our morality is not based on our identity, but on principle and our deliberate choices, both individual and collective. Many of us have friends and family in the region, some of whom, including my own family, have been killed. As human beings and as Muslims, our concern for Palestine is rooted in our commitment to justice, humanity, and our faith. Justice is not just a legal obligation, but it is rooted in our faith. In the Quran, we are urged to stand firmly for justice, even if it is against our own selves. Jerusalem, of course, is close to our hearts as Muslims because of the Al-Aqsa Mosque, Islam's third holiest site. While not all Palestinians are Muslim, those who are not our brothers and sisters in faith are certainly our brothers and sisters in humanity. We see our children in their children, and we refuse to accept the cruelty inflicted upon them. In response to the genocide, global protests have erupted in solidarity with Palestinians. Both the International Court of Justice and the International Criminal Court have ruled that Israel has breached international law multiple times. However, we have seen very little action from world governments to stop any of it, including our own. Some countries have openly rejected international law. Protests have been actively suppressed in some jurisdictions, and people have been arrested. Some have lost their jobs. And we have often been tied down by arguments over semantics and technicalities, wasting our time instead of focusing on concrete action. We cannot be spectators to a genocide. Our commitment to justice must be unwavering, whether that's through supporting the legal measures to hold Israel accountable, amplifying truthful media narratives, countering misinformation, supporting humanitarian efforts, or engaging in grassroots activism to put pressure on our governments and institutions. The Muslim Council of Britain don't want this webinar to be just another talking shop. Complacency is a luxury we cannot justify. We need, as Muslims, a united response. We want to support and build on the work that our partners and allies have already done, and to drive work that will drive actual change. We have written to the BBC and we will be writing to the Prime Minister and taking other actions in the coming months in collaboration with our partners and allies, whether our brothers and sisters on the ground in Gaza, here in the UK, or across the globe. Today, we're going to discuss some practical measures in law, media, humanitarian aid, and activism that are ongoing and that can contribute to justice for Palestine and the wider region. And we are honoured to be joined by our expert guest speakers to explore the next steps in the face of such overwhelming devastation and impunity. And first of all, I'm going to ask Dr. Mohammed Mustafa to speak. Dr. Mustafa is a British Australian emergency physician. He's based in Perth, and in June 2024, he wrote his will and volunteered in Gaza with the Palestinian Australian New Zealand Medical Association, working in hospitals that we unfortunately know too well from the media reports, Nasser Hospital and the European Hospital in Khan Yunis. He has provided medical care under extremely challenging conditions, often treating a high volume of patients, many of whom are children. He has described the situation in Gaza as a humanitarian catastrophe. Motivated by his faith and a commitment to humanitarian service, he has now returned for his second mission to Gaza, and he's joining us from Gaza today. Dr. Mustafa, we can only imagine the challenges that you're faced, the reality on the ground, and I would just ask you to share with us what the situation is like on the ground, and the reality that you're dealing with every single day. You can unmute yourself.
Well, first of all, assalamu alaikum, and thank you for having me. Can you hear me, by the way? Are you all? Can
Yes,
you
we
hear
can.
me?
Yes, we can hear you.
Yes, people can hear
Sorry.
you.
Well,
Please carry on.
So, it's my second mission to Gaza. The first time that I came was during the height of the war. I was actually there when the 4 hostages were rescued in June, and that resulted in the deaths of over 300 people in one day and injured of 1,000. And at the time, there was only about 3 functioning hospitals, and we were flooded with victims and, mostly children. This time when I came during the ceasefire, and I was present in the north of Gaza when the ceasefire broke and the bombing started. At the hospital that I was based in, we had over 150 dead arrive, and most of them were women and children. I remember waking up at 2 o'clock in the morning, about 1:30, 2 o'clock, when the bomb started. The intensity of the bombing was so much that my windows flew open, and I actually fell off the bed that I was sleeping on. And instantly we knew that something was different this time, that something was going on, because the room was shaking and we could hear screams in the background. I went down to the emergency department in my pajamas. I grabbed my stethoscope and my doctor bag. And there was the hospital that we're in, because most of the hospitals have been destroyed. The hospital that we were working in is called the Baptist Hospital, and it was actually a hospital that missionaries had opened a long, long time ago. And the emergency department there is only about 5 meters wide and about 15 meters long, and we had over 100 bodies scattered everywhere. It was so bad, the amount of casualties that we had, that I was putting chest drains in people on the floor outside the hospital, outside the emergency department. We were cutting people open outside the hospital because there were that many bodies that there wasn't any room for them in the emergency department. When you walk through, you will step on somebody. That's how many bodies there were. And I remember freezing for a minute and just looking around myself. And it felt like I was in a slaughterhouse. We had limbs on the floor that were missing bodies. We had heads on the floor that were missing bodies. We had bodies that were missing limbs and eyes. There was an ear somewhere. There was a pile of organs with no real identifying markers. We didn't even know if it was one person or it was multiple people, but they were fully melted from the bombs. it's hard to describe to you when you walk and all you can hear is screams of human beings and children crying, burnt alive, missing torsos and limbs, no analgesia, no anesthetic. We didn't have a single ventilator in the whole emergency department, so we couldn't intubate anybody. It was like walking through, a horror movie or a slaughterhouse, but this time it was humans. It wasn't, lambs and sheep and cows. It was actual human beings. Um, and when we finished that night, I didn't leave the department till about 10 o'clock in the morning. And I spoke to one of the doctors there, and he said, the first 3 months of the war, every day was like this. And my worry right now is that we're going back to that phase where we are just seeing mass casualty event after mass casualty event, and it's mainly children. It's mainly children that we see. We lack such basic equipment that it makes trying to deal with the amount of injured really difficult. I bought with me some personal use items. I bought with me a thermometer, and it was the only thermometer in the whole emergency department. There's no other thermometer. I bought with me glucose sticks and a sugar monitor. It was the only one in the hospital. And I was surprised because these were personal use items, and yet they were being relied on by the intensive care department, was relying on my, bag of personal items to manage to do basic care for patients. That's how little resources we have here in Gaza right now. The other issue that we have from a medical point of view is, a lot of these people are malnutritioned. They have been starved for over a year, and because of that, they arrive in the hospital already weak. They arrive already with multiple issues, and them having a major injury, there's very little chance they'll survive because they're not healthy to begin with. They get infections from the dirty water. They all have poor respiratory function because of the amount of dust in the air from all the bombings and all the buildings collapsing. And obviously living in burnt out, destroyed buildings, the damp in those buildings also caused a lot of the children to come in. When we came during the ceasefire, all of them had chest infections, stunted growth, malnutrition. The situation here, sometimes even as a doctor, sometimes I lose hope sometimes when I'm walking around and on the wards and I'm looking through and trying to help these kids, because the doctors on the wards are also overwhelmed. There's not many of them. So, sometimes we double up and I'm an emergency specialist. Sometimes I leave the emergency department to see children on the wards. And, these are children that have a broken leg that's in a pot, in a cast, and they're waiting sometimes a whole week or two to be operated on because there's just that many cases and not enough doctors and not enough equipment. And some of them end up losing their limbs. And if we just had the medical equipment and the doctors there, we could have saved that limb, but we just don't have the equipment. A lot of the kids get infections. And, I remember this one child that I saw, he was badly burned and he lost his entire family. The only surviving member was his father, but all of his aunties, uncles, cousins, mother, other siblings had all been killed. And he was scared to go near the window because the bomb had come in through the window and he had seen the bomb fly in through the window and explode. And he has major burns to his face and hands. And because the drones are always circling overhead, everywhere you go, you can hear the buzzing of the drones. And there's spy drones, there's drones equipped with missiles. He heard the sound of the drones and he hid underneath his bed out of fear. He was just so scared. And I asked his father, and he just said, yeah, he can't go near windows and he can't look out of windows, and he gets scared by that sound because that's the sound that was made just before the missile hit. And he's not the first one. Sometimes if you walk on the wards at night in the hospital, you'll hear screams. And the screams that you hear are people with PTSD. They recount when the building collapsed on them. They recount um, seeing their mother explode in front of their eyes, because the impact of the injury sometimes, or the bomb, um, causes people to explode into a million pieces. And people sometimes even as far back as 5 meters away from that survive. But what they remember seeing is they remember seeing their entire family blown into pieces. And just the screams. And it's something that we don't see or we don't talk about. But the psychological trauma of so many people here in um, Gaza is unbelievable. And that's why we really, really need the aid. We need people to donate. We need the borders to open to allow aid in, because even an item as small as a thermometer we don't have. And if we had a thermometer, we can diagnose people with sepsis and with infections more effectively. We can treat it quicker and we can monitor them better. And that can save a life. And it's just something as simple as a thermometer. So even a small amount of money can make a big difference. We need food here, we need medicine, and we need everything from major surgical equipment that cost hundreds of thousands of dollars to perform complex surgeries to things as simple as foil blankets, those aluminium blankets that keep people warm. Because I'm sure you've seen on TV how many children freeze to death. So a $1 blanket or a £1 blanket and $100,000 machine, both of them save lives, little and small. Everything counts. Um, and that's the thing with Gaza. There's never been a situation like this anywhere. I've spoken with many doctors here who have served in Iraq, who have served in Afghanistan, who have went to Ukraine, and the injuries and the complexity of injuries here, and the psychological trauma here for an entire population is nothing that's ever been recorded in recent history. So, you know, from a medical point of view, I'm urging everybody, don't forget about Gaza. Keep donating, keep helping, and keep raising your voice for Gaza. It's really, really important, especially now. And I'm trying to stay calm and not get too emotional. But like I said to you, just walking down the corridors of the hospital, you see, because the corridors are overfilled with patients laying on the floor, you see people with missing limbs, you see people with maggots growing out of their legs and arms and their open wounds. And even just simple things like, antiseptic wipes could help. I mean, that's how dire the situation is. Sometimes even just some wipes will could keep someone's wounds clean and keep them alive. That's how desperate we are here.
That is absolutely horrific. And I'm sure a lot of people will be really, I mean, we've heard so much, particularly during social media, but so much of this is not being reported on it's not being reported in the media. Just very, very quickly, I know I appreciate you taking the time to speak to us, and we've got some other speakers, but very, very quickly, um, are you getting the support from the international medical community? What more needs to be done from our side to help
No,
Gaza just as quick as you can?
we need a ceasefire. Look, ultimately, you know, we can't handle more sick people. We can't handle them. The hospitals are overfilled and overcrowded. And look, I'm not even mentioning to you the people that have cancer that aren't getting their cancer treatment, the children that are born with genetic conditions and need special. Put all of those people to one side. People with diabetes. Half the population that was on dialysis are dead in Gaza since the start of the war. Half the population that was on dialysis because they don't have access to dialysis machines. Even if you put all of these people to one side, and their need is huge as well, right? You just try and deal with the trauma and the mass casualty events that you have. We can't deal with it. We need aid in, we need medicine in, we need people evacuated for specialist treatment, and we need a flood of doctors. You could flood Gaza with 10,000 doctors tomorrow and give all the surgical equipment, and it would still take us months to get through everything that we need to get through. But that's what's needed. We need a global effort. And right now, I don't even see effort on a local level, a significant effort on a local level, never mind on a global scale. The situation is dire, and we are facing, especially very soon with the food being cut off and the electricity being cut off. If things don't change in the next week or two, the food is going to run out, or it's going to be very close to running out, and there will be children starving to death as well as being bombed to death. And that's what I think people need to urgently understand.
Thank you so much for joining us. If you can stay, we're going to have a Q&A at the end. If you have to go, completely understand. But thank you so much, Dr. Mustafa, for joining us and for sharing the brutal reality on the ground. And I do understand that's very distressing, and some people maybe need to take a breather from their computers. But the people in Gaza don't have the luxury of doing that. This is their everyday reality. And that leads very well into our next speaker. I'd like to introduce Munib Abu Ghazali. He is the Regional Director for Islamic Relief in the Middle East and North Africa. He has a comprehensive experiences in private and NGO sector management, both local and international. He has held leading roles in the sector for over 15 years, including being the country director for Palestine for Islamic Relief. He is from Gaza and has lived in Gaza most of his life. And he was in Gaza on October 7th and beyond. So he has also lived experience of this genocide. Munib, thank you so much for joining us. I think you're joining us from Cairo today.
Yes,
And I'd like to ask a very important, a very difficult question. As we heard just there from Dr. Mustafa, the situation with the aid blockade is stopping essential medical supplies, food, getting into Gaza. And what we're hearing from some people here is, they're unsure, are their donations making a difference? Are they actually reaching the people of Gaza? What's the reality on the ground? So what can we do to ensure that Palestinians are actually getting this, that they so urgently and desperately need? And can you just elaborate a little bit more about the aid situation and what needs to be done? Thank you.
Yeah, thank you very much. And Dr. Mustafa, thank you very much for the great effort that you're doing. And I can imagine what you're going through and how the situation is on the ground. Actually, as you mentioned, I was in Gaza on October 7th until April 2024, and I've lived, a good portion of it, but it wasn't the hardest actually. Now it's really very tough because it's just like a snowball, and it keeps magnifying and magnifying, and the need and so on. So I would like to touch base on 3 points actually. Probably some of the things in the health sector has already been mentioned by Dr. Mustafa, but I would like to again touch base on the situation on the ground from my perspective, as well as what we have been doing and are doing now, and then the role of the supporters as well, because it's very important. So I definitely don't need to talk about the numbers and the cases that you have already summarized in the beginning, and Dr. Mustafa has talked about some of it and it's all on the news on daily basis, Yani. So it's basically obvious for everybody. We all see in the news, the land, how it is shrinking, the essential needs, how they are vanishing, and, how buildings are being demolished and so on. Our team on the ground, as well as partners and families on daily basis, although they're trying to support as much as possible, but just running from one place to another, seeking, kind of refuge wherever they can find it. And I've been through this as well for 3 or 4 times, moving from one place to another in the beginning. But we don't really hear much, just like Dr. Mustafa said, about people that are suffering from severe pain due to, chronic illnesses or different emerging illnesses. I keep remembering we've been supporting, the health sector for years and years before this kind of like genocide. And I keep recalling the number of Al-Shifa Hospital, mainly in Gaza, used to serve around 1.6 million cases per year. these 1.6 million cases per year have not been served for the past year and a half. And the same applies to the other 13 hospitals. Dr. Mustafa has already mentioned 2 of them in the southern area. Cancer patients that are not finding painkillers, even not to talk about the medications, of course. And I can tell you about a recent story of a relative that I talked to on Eid and asking him what they had as a food during Eid, and he said, "Look, we found actually 2 tomatoes, 2 potatoes, and we had to cook them. And alhamdulillah, we had some bread to eat them." They are a family of 7, relying on this. This same person actually was on antibiotics since October 1st to 23, because I recall he's a relative of mine, and he was being prepared for a kidney surgery because he had some kidney stones. Until now, he hadn't gone through the surgery. And I know that I believe that there are hundreds of thousands of cases like this. These are kind of like silent, if I might say, pain that nobody can hear or see on the news. Although it is really devastating to see the killing that's going on, but honestly, I mean, the people that are suffering that are the alive ones that are seeing and witnessing this on every day, and still suffering from the lacks that are there. We have, as Islamic Relief, we have been providing services to alleviate this suffering since the beginning. In food security, shelter, water and sanitation, as well as education and health. We have served like around 72 million hot meals since the initiation of this, genocide. In addition to some ready-to-eat parcels and vegetable baskets, whatever we can find, in food security, we have been supplying. We have been, providing some household winter kits, as well as essential, non-food items for households. We've been providing and still are providing drinking water for shelters in around the Gaza Strip. We have been providing again shelter cleaning kits and hygiene kits for 85 shelters around the Gaza Strip. These are being provided together with the manpower needed for cleaning, which is basically, again, we consider as supporting a number of households with cash for work, basically to survive during this as well. And in education and psychosocial, we've been doing our best to provide psychosocial support for children and caregivers. In the health sector, actually, we were actually furnishing and equipping the maternity unit in Gaza, in Shifa Hospital, before these incidents, and unfortunately, it was, I think, destroyed. And now it's again, we're trying our best to support the maternity units in the different areas as much as they are available, although they are very, very scarce. We are, of course, all of what we have been doing wouldn't have been done without the support of the communities. We do have plans for a recovery stage that we're hoping that it will come soon, because without the health services, like Dr. Mustafa said, without municipal services, it's really a disaster. The situation is and will continue to be. And so revival of the health and municipal services are on top of the priorities. And we definitely need not to forget the housing, whatever situation is. I mean, some people are living even under a roof that is have been actually destroyed, but the roof is kind of like, even if it's standing, tilting, kind of like they use it as a, as a cover for their living. So whatever is available is being used to support the people in this. Alhamdulillah, as I said, this would have never been possible without the support of the communities. And we believe as long as the team on the ground are capable of continuing to provide service, we believe that we are obliged to keep supporting them. And I believe this is, again, the message for everybody that has been supporting, that we're all obliged to continue supporting these people, to continue, our team to continue providing the support to the community. Whatever is available, again, as I said, now the situation is very difficult. Very scarce quantities and are available. We're trying to, whatever we can do, as I said, to utilize and provide services with. We believe that even the cleaning and servicing of hospitals and removing rubbles, if whenever is possible, is still a duty on ourselves. Our team, honestly, we do have a plan. Again, for the emergency, we do have a plan for the recovery. We do have a plan for the hope for the reconstruction, but nothing is basically going according to plan. Now we have to be as agile as possible. So honestly, the team are doing their best to do whatever they can with whatever is available. And alhamdulillah, at least for water now, they're supporting very minimal quantities of ready-to-eat packs that they still have. They are distributing. So that's how the situation is, honestly, from our side. And I believe that our duty as Islamic Relief, our duty as whoever can support, like Dr. Mustafa going down, and the communities, is an obligation. And I personally believe whoever decides to support, it's not his or her choice, and he has been chosen to do that. So he is also lucky to be part of it. So that's what I can say.
So can I just very quickly, so a lot of people are asking the questions. We know that there's a lot of aid waiting on the border. Where does the pressure need to be applied for that aid to get to the Palestinians in Gaza?
Well, UN agencies are not being able. I mean, many of our support on the ground was in partnership with the World Food Program, WFP. Even the WFP, even the whole UN system is not being able to bring in any type of aid. Dr. Mustafa just like now said that the hospital is relying on personal, diabetes test kit. So the aid is global. Everybody has to put pressure on the occupation to end this disaster. And it's the duty of everybody, honestly. And it's not only, by the way, just like, thank you for raising this point, because it's not only that it's not only the role of the supporters to provide financial aid or support. It's also to put pressure on the global community to comply with international rules, international laws. And you have said in the beginning that your support to Palestine is not kind of like a type of bias or anti-Semitic or whatever. It's not a support for Palestine. It's actually support for justice. So if it was an unjust case, you wouldn't have supported. I wouldn't have. I'm a Gazan, I'm Palestinian, but it's a just case. So I mean, our role is to support justice wherever it is, and to alleviate suffering wherever it is. So So I think it's a role of everybody to say to be as loud as possible and as vocal as possible and as supportive as possible to end this suffering. I keep hearing, if you allow me, I keep hearing questions, over and over again that aid doesn't get in, and a counter question that I have: how is aid is being delivered if it is not getting in? It's now it's not getting in. I know, but it's been going in, and we have been. I mean, even internally, I know that people. I mean, I personally lived on on some. Green leaves from the ground, growing for weeks and weeks, if not months. So whatever is available is used. But again, to get this thing available, it needs support. the least is, for example, for water. I mean, water is available in some places, but you need to buy it and transport it. We do have a challenge of transportation now, but again, donkeys and the old ways are being used, but I mean the cost is very high there now, and it needs to be done. Whether I mean we shouldn't like give up and say that nothing can be done now if there is a glimpse of a chance that we can do something. So yeah. And that's the role of the people on the ground and the organizations that can convey the message of the people on the ground of what can be done and how it can be done. We have to keep trying.
Okay, thank you very much for sharing and for that important clarification. This leads very well onto our next speaker. Taib Ali, he's known, anyone who's on Twitter or on social media will have known him very well. He's a leading international lawyer and human rights advocate. He's outspoken on Palestine, and he's the director of the International Centre of Justice for Palestinians, the ICJP. He's also recently launched the Global 195 International League Coalition to pursue Israeli war crime suspects worldwide. Taib, sorry, can we have a spotlight, please, on him, please? I just want to ask you what the ICJP is doing from a legal standpoint, and the work that you're doing to hold Israel accountable for its actions, to get aid in, as we've heard already. I think that's really pressing. How can that happen? Does international law exist? I think a lot of people are asking at the moment. What can we do as individuals, as organisations, to support your legal challenges and your global 195 initiative? Thank you.
Well, first of all, I don't know if international law exists, to be honest with you. I do know that the concept of justice exists, and my work is more about achieving and striving for justice than it is about trying to protect or maintain any form of rule of law or international law, because what we've seen the last couple of years is really quite straightforward. International law has been used by powerful Western states to further their foreign policy. And it's very important that organizations like the Muslim Council of Britain, and I noticed, by the way, that you have hundreds of people listening to this webinar. And that's testament to the power and reach of the Muslim Council of Britain. And I'll come to why that's important in a minute. But before I talk about the ICJP, I really do want to pay tribute to the charitable organizations that provide aid directly to Palestinians in Gaza, West Bank, and East Jerusalem, and also outside of that direct region, and also to really my new class of hero, which are the doctors that go into Gaza, like Dr. Mustafa and others, that put their life literally at risk to give medical aid to Palestinians and just human beings on the ground in that territory. I've had the pleasure or displeasure, I don't know which one it is, to have been responsible now for interviewing at least 40 or 50 medical professionals that have been in Gaza as part of our campaign, Gaza Justice for Gaza campaign. And I just want to explain, not everybody knows what ICJP is. The ICJP is the International Centre of Justice for Palestinians. And it's an organization that we created a few years ago in order to try to actively bring resolution to the violations of Palestinian rights. And we've been doing that for some years now, and in some aspects quite successfully. But to bring this, what we do generally is we lobby, we litigate, we bring legal cases across the world in regards to the Palestinian issue, mainly at international tribunals such as the United Nations, ICC, and as you know, we support ICJ legal actions as well. But what I want to talk about today in particular is the work that ICJP has done with regards to Israel's acceleration of its occupation and attempts to commit acts of genocide with regards to the Palestinian people after October the 7th. And why I want to talk about that is by October the 9th, we knew at ICJP, probably along with a lot of other people, judging on Israel's record, criminal record, in fact, that Israel would enact a form of vengeance in the name of self-defense against the Palestinian people, which would further long-standing right-wing extremist policies within the Israeli government. And that included, in our view, the annexation of Palestinian land and the annihilation of the Palestinian people. And what we've seen unfortunately, what we've seen over the past couple of years since October the 7th is exactly that. There's no doubt in my mind that Israel is committing serious, severe crimes against humanity and war crimes against the Palestinian people. And there's no doubt in my mind, although it hasn't been adjudicated on yet, that what Israel is doing against the Palestinian people is an act of genocide. Now, our Justice for Gaza campaign collected evidence against with regards to what Israel was doing on the ground in Gaza. And so far, we've collected over 140 eyewitness testimonies. And that eyewitness testimony is collected to a British criminal legal standard, which means it can be used in British courts, the ICC, the ICJ, and almost any criminal jurisdiction anywhere in the world. We have collated 140 of those statements, and that tells a very clear evidential story to us. It tells a very clear evidential story of war crimes. But recently, just as the ceasefire was broken by Israel in the last few weeks, ICJP launched a second part of our Global 195 campaign. And that part is because we were fed up of having the information, having the knowledge, having the evidence, having given that to governments and the British police. And when I say having given that to the British police, we've lodged a complaint against 5 British Conservative ministers for war crimes or complicity in war crimes. And that complaint is being considered at the moment by Scotland Yard in what they call a scoping exercise. And that's the first step in an international prosecution that the police have to go through. But we got fed up of waiting for them to look at that. And while we were waiting for them for months and months and months, literally tens of thousands of people were being killed in Gaza. Not 2 or 3 people, not hundreds of people, tens of thousands of people. So we decided that we had a bigger responsibility than just collating evidence and hoping that some law enforcement agency in Britain would decide to actually act on it, or Keir Starmer in his legal wisdom would decide to act on it. And so we decided to take direct legal action, but not just any old direct legal action. We've launched a campaign called Global 195, which is an ambitious campaign to create a legal network in every country in the world, all 195 countries, including Israel, including the Vatican, including in Palestine, and make sure that every law enforcement agency in every country receives a complaint of war crimes, naming the specific actors, the Israeli military actors, the Israeli political actors, and all the way down to the Israeli foot soldiers. So that's part 1 of the Global 195 campaign. Part 2 of the Global 195 campaign is where law enforcement agencies don't take action against people in their jurisdictions for war crimes. Our legal teams and at the moment we have tens of legal teams in tens of countries with an ambition to grow, and it's growing very rapidly, by the way. Our ambition is to take direct private legal action against individuals. And so we're about to launch in the next couple of weeks a legal case against potential IDF soldiers in the UK. I don't want to go into more detail about what that'll be about, but we'll issue a press release at the time we do that. Just last week, we issued a complaint to police officers about a very particular IDF soldier that we had evidence had committed war crimes and was in the Romanian jurisdiction at the time. Once we'd issued the complaint, my understanding is that he fled from the jurisdiction, or he's fled from the jurisdiction. But we publicized that complaint. And the objective is to make no country in the globe, anywhere in the world, a safe haven for Israeli war criminals. It's really difficult work, but the strength and reach of the Global 195 project is promising. And we've already got legal teams operating across the world. One, gathering intelligence on Israeli soldiers that are traveling to those jurisdictions with a view to having them prosecuted. And before people think that this is a futile exercise, I will say to you that the entire project is based on a case that we did in the United Kingdom in 2009, where we in fact used this type of strategy to get an arrest warrant for Tzipi Livni, the Israeli foreign minister. And what a British court did was issue an arrest warrant for Tzipi Livni. And that resulted in a couple of years of breakdown in diplomatic relationships between the UK and Israel. And then what disgustingly the British Parliament did with its MPs is it changed the law to have political interference in that process. But we haven't been deterred by that. And again, we've redoubled our efforts. And because in light of what's happening in Gaza, we've decided that this is the project that we want to now put forward, and we have.
Thank you very much. I think there's a lot of things going on and people aren't always aware. So it's really important that you're able to highlight that. I'm hoping at the end there's so many questions. There's about 90 now questions. And I'm hoping we'll have.
Naomi, would it be helpful for me to just run through like 4 or 5 things that people can do to support this project?
Please do.
Yeah, okay, great. So it's really important. I mean, like, you guys that are at this webinar are crucial. It doesn't matter what you do. The first thing I want to say to you is that in every aspect of your life, job, friendship, neighbors, you must talk about what's happening in Palestine. And you must talk about it sensibly, but you must talk about what's happening. We cannot rely on the mainstream media. That is the least that any one of you can do. Now, of course, you hear me. I'm a partner in a massive law firm in London called Bindlands, and I am talking about this in work. I'm talking about this outside of work, and I'm putting my personal consideration about my role in my law firm as a secondary issue. I don't think my law firm would do anything about the things that I'm saying, but if they did, what saying and talking about what's right is much more important. If you're a legal professional, join us. Contact me at global195@pm.me. I'll put that in the questions and answers where somebody will, if anybody asks me that. So join us if you're a legal professional. If you're a legal professional from outside the UK, get in touch with me. We want to set up teams in each of your jurisdictions. The second thing you can do is financially contribute. We need funds. This is a huge project. It costs hundreds of thousands of pounds to carry out this kind of legal work. We need help in funds. You can go to www.icjpalestine.com. There's a donate link there. Please donate. We're not a charity. We're a not-for-profit NGO. And that means that we can do political work, which a lot of this is political work. So that's really important. And the other thing is we need, if you have, now the Muslim community comes from all over the world. If you have government contacts in the jurisdiction that you're linked to, please get in touch with them and please put them in touch with us, because we also speak to governments and brief governments, and you will be gobsmacked. When I speak to governments across the world and I tell them what's going on in Gaza, they really sometimes don't know. I know it sounds ridiculous, but they can be switched off from what's really going on the ground. And our lobbying, our briefing, our information to them makes a massive difference. Every single one of you is a crucial advocate in this cause.
Thank you very much. I think you've just answered about 20 questions there in 2 minutes. So thank you very much. And we will probably come back to you at the end. So thank you. And now I'd like to introduce Ruzwana Hamid. She's Director of the Centre for Media Monitoring and an award-winning journalist with over 30 years in the media. She's worked with the BBC and Channel 4 on investigative films. And she's recently, the Centre for Media Monitoring has been doing a lot of work on Palestine, exploring media bias. They just released a report called Media Bias Gaza 2023-24, which was launched in Parliament. So thank you very much for joining us. I'd just like to ask you, what is CFMM currently doing to counter the media bias? Obviously, we've got some reports, but what are you sort of actively doing in your day-to-day work to promote fair coverage? And what can we do as individuals, as organisations, to support your work, to challenge this misinformation and demand accountability from these media outlets?
Assalamu alaikum, everyone, and thank you for giving this time for us to discuss this. Prior to October 7th, CFMM's brief was really to look at the misrepresentation of Muslims and Islam in the media. And of course, within that, we used to look at the coverage of Palestine, and there's been, hotspots in terms of periods when it's been in the news more frequently. But obviously, as everyone knows, since October 7th, we just have not seen anything on the scale of what we've seen in the media. It became very clear very, very quickly, within days, that not only was the media very biased in how it was reporting what was going on in Gaza, but I would describe fellow journalists as Stepford wives. Everybody had gone into one, they had historical amnesia for a start. We know October 7th became ground zero for them. Even seasoned journalists who've been covering that area for years gave no context, gave no background. The framing was completely biased, and they just lost their lack of their ability to be robust, to challenge, to hold the Israeli government to account, and by all kind of, intents and purposes, have bought into the Israeli narrative. So we saw our work having made quite a bit of progress pre-October 7th. It's like we've gone back decades now in terms of our one relationship with media organizations, because we have good relationships with editors. We work with editors and journalists to try and improve this coverage. But those that prior to October 7th were on board, many post October 7th have either stopped engaging or are still engaging, but have been very difficult to persuade. And that's primarily because the Israeli machinery is really well oiled. So we know, speaking to editors, that they say to us, listen, we are being pressured by the Israeli side. What are you guys doing? You need to up your game. So I think in terms of as communities, from Muslim communities and beyond, we really need to up our game when it comes to the media, because there is no one more influential in terms of public perception as well as influencing policy as the media. We know that, which is why we're trying to tackle that. We know that there has been pressure, even with the likes of The Guardian, for example. There's been leaked papers to show that there was pressure internally, and their editor, who a decade ago was very pro-Palestinian, lived in Palestine, used to write about Palestinians and Palestinian issues from a Palestinian perspective, has really been cornered by the Israeli lobby, to the point that even a paper like The Guardian, you saw the same levels of bias as we saw in all the other media outlets as well. So it was across the board. And the first report that we did, obviously, we looked at over 200,000 articles and broadcast clips, a huge evidence base. And what we saw there was inconsistencies and biases, whether it's to do with language, context, framing, a lack of prominence given to Palestinian voices, when it comes to Palestinian voices being shut down if they try to give a context or they try to give the reality on the ground. We see presenters taking on a position in terms of actually defending the Israeli point of view. So it's unprecedented to hear presenters say at the end of an interview with a Palestinian, well, Israel would deny what you've said, and of course, Israel would say. So they'll always put the Israeli perspective when it comes to Palestinians. Interviewing Israelis, they'll never put the Palestinian perspective. So there's clear bias there. I could go on, but I think people understand the levels of bias that are there. So in terms of what people can do, and I would say within the media and within the industry, we are going through the equivalent of a McCarthy era. People are being censored, people are being silenced. Muslim people who work within the industry are finding it really difficult to change the narratives, to push stories that give a different perspective in terms of mental health problems, feeling isolated, feeling that there's no one to go to on a senior level. People within the industry are really up against it. So they're trying to battle internally, but I think what it needs is help from the outside. So I'm going to kind of suggest lots of things that people can do. The first thing is that we are going to be releasing a report looking at 1 year's coverage of the BBC's reporting of the war on Gaza. And why is the BBC important? The BBC is important because it's a public service broadcaster, but also we pay a license fee to watch and run the BBC. So therefore, the BBC has to be representative and reporting in unbiased way. And clearly our evidence shows that even the BBC has not been doing that. So we will be releasing the report in May. And what we want to do is create a whole campaign around this report. We need everyone that's on this webinar and beyond to, one, publicize the report. So you share our findings on social media, within your organizations, within your workplaces and beyond. So sharing it is number one, so that we publicize it as much as possible. The second thing is to then, I think personally, is to create a campaign where, following the evidence that we will give you, is to get mass letters sent to the Director General of the BBC stating that, this report shows that there are levels of bias. BBC isn't as bad as some others, but the point is it still is bad, and it is a public service broadcaster. So letters with hundreds and hundreds and hundreds of signatures need to be written, and we will draft those, and we can liaise with the MCB and affiliates, etc. And then to push forward the recommendations that we will be putting to the BBC as well. And that's to do with things like language. So, for example, every time that the BBC or other organizations speak of Hamas, they'll always say, designated as a terrorist organization. So why is it that they don't say, when they speak about Israel, that it is an apartheid state and an occupying force? We want them to be consistent in how they describe governments, organizations, etc. In terms of when they speak about Netanyahu, why do they not say that he is wanted for war crimes? When it comes to the use of the word genocide, obviously human rights organizations, the United Nations, the International Court of Justice, lots of international organizations have said that there's plausible cause that Israelis. So we want the word genocide used when it has to be used. There's many, many examples. And obviously, once we get the report out, we will do a briefing whereby then people can kind of take action. The other things that people can do is, because it's not enough when you see problematic coverage to just kind of moan and groan about it, or talk to it about your families and to family and friends, or put it on social media. You need to complain, whether that complaint goes anywhere or not. The point is, every time a complaint is submitted, it has to be logged. And again, what I know from speaking to people within the industry is that there are many complaints being put from the other side, and we are not matching that level of complaints. So we need to kind of become more active and take the time to make complaints. And whether it's for newspapers, it's going directly to the newspapers or then to the regulators. IPSO, when it comes to the BBC, they have a direct level of complaints that you need to do on there, or you can go to Ofcom. We offer training in terms of how to submit this complaint. So again, if anybody is interested individually or as organizations to receive this training, write to us at admin@cfmm.org.uk, if somebody can put that in the chat, saying that you would like this training, and we can create a webinar where we can, teach people how to make these complaints. The other things that you can do, we have a WhatsApp group. So whenever we come across any problematic coverage, obviously we'll complain directly. And because we have the ears of editors, we can normally email them directly or pick up the phone. And we've got many, many things changed within minutes when it has been inaccurate. And that's been at the BBC, it's been at newspaper, it's been across the board. So that we do that on a daily basis. We're complaining, we get things changed when they're inaccurate. And people say, again, what's the point of that? The mistake's already been done and the damage has been done. Again, it's being logged, it becomes evidence, it becomes things that we can then use to say, look, this is how many times you got it wrong, this is how many times you had to correct. So there's a WhatsApp group that we have where we submit action alerts. So if we find a story where we think it's really problematic and harmful, we put out an action alert and we get hundreds of people to try and complain. You can join that WhatsApp group. Again, email us at admin@cfmm.org.uk and we can get you onto that WhatsApp group. There's also another organization called Accountable Media, which was set up by young Palestinians post October the 7th, and they've done amazing work. What they've done, and they focus specifically on Palestine, but they've created automated complaints sheets. So you just go onto their website and we share information. So if we want mass complaints to be done, we'll contact Accountable Media. They will then push it out on social media and there'll be a link there. And literally, you will have all the information filled out for you, but you just need to submit that complaint. So that's another thing that you can do. I would say, keep badgering your, I mean, this is not the media, but I mean, keep badgering your MPs, create local groups, keep forming alliances with other organizations, keep going on marches, keep putting up the pressure. As Tayyip said, keep speaking about it in every single workspace and make it a point of discussion and to keep bringing, because it's uncomfortable. People don't want to talk about it, or people feel that they can't talk about it because then they'll be accused of being anti-Semitic. And that's a lot of the reasons why people are being silenced, whether it's kind of public figures or within organizations. But I think the time to stay silent has come and gone now. We can't put ourselves, we can't put our professions, we can't put our jobs. I know we all have bills to pay and families to support or whatever. But the point is, this genocide is unfolding in front of our eyes on a daily basis. And as Dr. Mustafa was explaining, in terms of what the reality is on the ground, we cannot be afraid to speak up and do whatever we're doing in whichever corner that we're doing and in whichever kind of area of specialism. But we've also got to create alliances and start working together to make our voices much louder and to be heard. Just as the Jewish Board of Deputies is, just as the Community Security Trust gets their voice heard. They are very active. We know that the Israeli side has a media document, a strategy, and it's like a 20-point strategy of how to win the Western media. So they are very strategic in how they do things. CFMM could be doing a lot more. We, up until a year ago, we were 3 people working. We've just increased to 5 people, but we need more people. We need more resources. We could be doing so much more. And again, like Tayyab said, we and Islamic Relief, we need your support both financially and otherwise as well. I mean, I could go on this so much more, but I'll leave it there because I think it'd be important to have Q&As as well and
Yeah,
some questions that people may have.
Thank you so much, Rizwana. That's really powerful. Some really practical suggestions. I think it can be very frustrating seeing the media, but it's very, very true. We have to complain to the media, not just about them. And with that, we're just going to have our last speaker. I appreciate we had advertised this to be 1 hour, but we'd rather you hear the important work that our guests are doing and extend the time if you will allow us to ensure that everyone has a chance to speak. And there's so many questions, we would like to get to some of those at the end. So finally, I'd just like to introduce Ismail Patel. He's the chair of Friends of Al-Aqsa and a leading advocate for Palestinian rights. He's a researcher and writer with a PhD in Islamophobia and Muslim identity and has authored several books, including The Muslim Problem and books about Palestine. Ismail, thank you for joining us. And I think you're going to be able to really speak to the activism, the grassroots activism that's so important. What are you doing at Friends of Al-Aqsa at the moment to mobilise that activism? How effective do you think that has been? And what can we as Muslim individuals and as organisations do right now to support Palestinians? Do we need more protests, boycotts, political engagement? Do we need something new?
Jazakallah, Sister Naomi, and Jazakallah to friends, to MCB for arranging this event. And of course, everybody who's participating, make du'as that Allah subhanahu wa ta'ala gives barakah in our gathering and helps us accept our efforts to change the situation on the ground. But I want to start by taking a long view. And normally, we have always asked historically, how was it possible in 1947 that 700,000 Palestinians were expelled and nearly 80% of the country was occupied? Similarly, we asked the question, how is it possible in 1967, while millions of Muslims lived around the region for the Zionists to occupy Palestine? And here we are in 2025, in front of our very eyes and in front of our lives, that we're witnessing tens of thousands of people being killed. In a way, I suppose the thread that connects all those tragedies is the fact that majority of the people felt that somebody else should be doing the job, or felt that they were not in the position to be able to help. And I think this is a malaise that we have to get over. Every individual can make a difference, and we will be judged in the hereafter according to our own abilities of what we can do. So we should first and foremost stop looking at other countries, other leadership, and other people to do something about this. Let us all ask ourselves, what can I do? And then move into that arena and try and bring about the change. And I'm very convinced that if the civil society around the globe get together, inshallah, and work with sincerity and with the help of Allah subhanahu wa ta'ala, then we can bring about a change. As we have heard from Dr. Mustafa and Munib and Sister Rizwana and Brother Tayyab as well, that this is a political issue. While there is a humanitarian crisis going on, giving as much aid as we like it's a bandage to solve the present problem. But the long-term solution is to end the siege, end the occupation, and free the Palestinian people. And that is a political project. And for that political project, that's where Friends of Al-Aqsa comes in, and the people who have been supporting us to come out and do whatever we can to change the situation. And I want to touch on two parts here. Let me first give you the positive aspect. Despite all the horrors, and it can never pay the dividends, or it can never be equivalent to what is happening in Gaza, but Israel is also feeling the pinch. If you just look at what's happening to Israel at the moment, economically, the Israeli budget has shrunk what was expected to be by 8%. That's a debt of $240 billion since October 7th. The economy has collapsed. It was expected to grow by 3%. It's down to 1%. Gaza genocide, carrying out the genocide itself is costed so far $66 billion to Israel. That is phenomenal. Those factors haven't just emerged. It has emerged because of the civil society and because of the pressure the civil society has been bringing it about. On the demography itself, there's an estimate, a higher estimate, this is in The Guardian, that nearly 1 million Israeli citizens have left Israel. That is very significant. And the impact, the reason this is happening is because the moral standing of Israel is dropping, not simply because of what they're doing to Gaza, it's because globally the civil society has risen up to show that this is not acceptable. Yes, the political leadership in the world is still supporting Israel, but the civil society has made it so that Israel has become a pariah state. And that fall in grace, if you like, is directly as an impact of the actions that are being taken place by individuals like myself and all the individuals who are here listening to this webinar. If you look at the universities around the world, it was unprecedented that universities in America and Europe would have encampments in support of the Palestinians. We have people in the social media, social influencers in Hollywood, football stars, football supporters. All these groups are coming together. We have 15 countries around the world who have withdrawn their ambassadors from Israel. In Britain, we've had about half a dozen councils who are divesting from Israel. Each council, we're talking about hundreds of millions of pounds, of pension funds being withdrawn. These are significant projects. These projects are long-term projects, which you need to work day in and day out, campaigning, lobbying, and carrying this out, very targeted, focused approach, so that we bring about that impact. Yes, what our government is doing is different. So all these things are happening because of civil society. Now, the third part is the very sad part that I want to touch upon. Unfortunately, over the past few years that we've been working on this field, and particularly over the past 18 months, we have seen the Muslim community's commitment wane on this issue. Yes, we are very sympathetic. Yes, we do give money and think that that absorbs our responsibility. But my brothers and sisters, that is the only minimum amount you can do. It is paramount that we continue with the campaigning that Sister Rizwana talked about, that Tayyab talked about, and the things that I am asking for you to be committed to, and to ensure that we as a society change the situation. And we can make a difference, as I've already indicated to you by several parameters, and we can make that change significantly. Just think what we did last May at the general election. We managed to bring 5 independent MPs. There is going to be another election soon in May for council elections going to take place in many counties around the country. We need to remobilize and bring that into the political arena to show that this is not acceptable by the civil society. The government, when it does not listen to the population, means that it's not being democratic. They are the ones who should be hanging out as pariah. It is very sad to report that the last demonstration we had in Ramadan, I would say nearly 70% of the participants were non-Muslims. Where are we? Why are we then saying, what can I do? Alhamdulillah, the brothers and sisters who are in this webinar are the ones who are doing things. But I want you to take this message around the country. Explain to them we are making a difference. Yes, the genocide is continuing, but we need to stop that genocide. And we cannot give up. How can we give up when Israel has not stopped giving up killing people? When it is continuing with its massacres, when it's continuing with its genocide. So we have that moral responsibility. And from Friends of Al-Aqsa, not to overburden you with, please follow our social media network, Instagram, so you know all the projects that we are doing. In fact, we do most of the stuff Sister Rizwana has mentioned, support ICJP and all the other actions. But on the 12th of April, we have a very targeted approach. We are trying to have a national campaign to boycott Coca-Cola. You know, it is a shame, again, that Muslim weddings, Muslim events, Eid parties were taking place with Coke. And then we raise hand to Allah subhanahu wa ta'ala and say, Allah, solve this problem. Yet we cannot sacrifice this. You know, we need to be able to do this and campaign and find out through our website why we have to do that. On the 26th of April, we have another campaign carrying on that we want people around different parts of the country. 26th of April is the Coca-Cola campaign. The 12th of April is local demonstration in different cities around the country. We have already about half a dozen cities that is going to have demonstration. Please participate. But more importantly is on the 17th of May. That will be 77 years of Nakba. 77 years of Nakba, my brothers and sisters. It has carried on. We are worried about it now. Yes, this is horrendous what's happening in Gaza. But this problem, the Nakba, has been carrying on for the past 77 years. We need every Muslim organization, every masajid, to announce that people should come out on the 17th of May in London for the national demonstration and show our support. Let's come out in our millions so that we can make that impact. Do not believe that they are insignificant, because if they were insignificant, the government would not be working so hard to ban us. The government would be not working so hard to make the police make it so difficult for us to demonstrate. And the Israeli lobby would have not gone so far as to try and make us, to stop us demonstrating. They are very, very effective. Yes, they're not giving us a direct impact overnight to stop the genocide. That's our final goal. But these are the means, demonstrations, boycotting, campaigning, lobbying, all the different organizations from media to the politicians. These are the tools that we have got of civil society. This is something we can do. Talking about it is something we can do. And that's what we should be engaged in. And we need to bring about that change. And finally, what I would like to end on, that while the Palestinian issue, of course, is a humanitarian issue, it's an anti-colonialist issue, it's an anti-racist issue. But for us as Muslims, it's an issue of Iman. Because Baitul Maqdis is a land that is blessed by Allah subhanahu wa ta'ala. It is an amana to the one who has prayed the kalima. And therefore, it is a responsibility of every Muslim to protect that land and protect its inhabitants. And therefore, for us, we are doubly bound in the link through humanity and through our faith to do whatever we can. So brothers and sisters, as all other speakers have mentioned, let us get together and do whatever we can, and whatever little we can do. And inshallah, in a united way, we will be able to bring about a change. Jazakallah.
Okay, thank you for that very powerful challenge to all of us as Muslims. It's essential that we do more. And I think there has been a degree of complacency. And I hope that people will be leaving this webinar today with a little bit more of an idea of what they can do. I would just like to, I know there's so many questions. We have about 191 questions in the chat. I'm sorry, we're not going to be able to answer all the questions. There are a couple that are asking for contact details. We will be able to share those. This webinar will be available online, and we will share any contact details with our panelists and other links so that you'll be able to follow those. Some of the questions that we've had. So I'm just trying to look through them because there's so many. I had done some. So I've lost all the ones that I had done. So a lot of people are asking about direct action and what we can do within legal perimeters. What more can we do? I think this is probably for Brother Taib particularly, or Brother Ismail. What are our legal perimeters? What more can we do in terms of direct action, boycotting, to be more effective in our day-to-day lives?
I think, as Ishmael said, we're not turning out in sufficient numbers. I mean, we've probably broken records already in terms of the protests that we've held, but it's clearly not enough. I think protest comes in different ways. Turning out to the protests organised by Ishmael Patel is really important, and the coalition, that's really important. I think when you engage with politicians of every party, it's important to tell them what you think in clear terms and make sure that they understand that. I think that type of direct action is really important. Now, of course, I'm a solicitor, and that means that I'm an officer of the court, which means that I can only advocate protest which is lawful. And I'll just say that and pause there in terms of direct action. So any action that should be taken should obviously be lawful. But boycott is really important. I'm astounded when I travel at the number of people that will talk about Palestine and offer me a Coke or will offer me a Pepsi or will we just don't understand how powerful a thing that is. And if you just take as an example outside of the context of what we're talking about, when Elon Musk has made his gestures in the United States like he did in the far right, supported Trump, made some really hateful comments about Muslims and the United Kingdom and people here, his Tesla shares have dropped phenomenally, almost broken the company. That's put pressure on him. You've noted that he slowed down in his rhetoric as a result of that. You've noted that it's put direct pressure on him. There's just a really clear example of how boycott works, how disinvestment works. And I think that every single one of us has that power in our pocket to just simply stop purchasing things that supplies money and power to the war machine that kills your brothers and sisters. It's really that straightforward and that simple.
Very much.
I just add on that for boycott, I think what we need to be is very strategic. So I really encourage people to look at Friends of Al-Aqsa website and target the products that we're doing so that it makes an impact. Sometimes when we're enthusiastic, we have a list of 20, 30 products, and then after a few weeks or months, we give up. So let's be strategic and let's be focused and hopefully try and bring about a change.
Okay. So just to finish up, I think this will answer a lot of the questions because there's a lot of repetition in the questions. If I could just ask each of the panelists, starting with yourself, Dr. Mustafa, I'm glad to see you're still on the call with us. One action that every one of us can go starting tonight, starting tomorrow, and do for the people of Palestine.
Look, there's many actions to do. I think what's unique about sorry, I was just cut off there. Look, I think what's unique about everybody is this thing for me might not work for you. Some people are very, very good at boycotting, and they can cut out Coca-Cola and McDonald's and all of these things from their life. Some people aren't very good at that, but they're very good at talking, and they've got an eloquent tongue. They're good at campaigning. They're good at ready to do something. My ability is to come here to Gaza and persuade my mother to let me go to Gaza. I'm able to do that. If your thing is able to boycott, then just boycott. If you don't have the money to give, make sure the money that you do spend on your day-to-day life isn't assisting and enabling this ongoing aggression. If you can pray and can wake up in the middle of the night and you're good at doing that, then get up in the middle of the night and pray. Whatever you can do, you should try and do it. And what's good for me might not be good for you, and what's good for you might not be good for me, but everything helps. And remember, this is a collective effort. No one's asking you as an individual to solve the problem, but what we're asking you to do is to do the best that you can. So, there's no one answer for all of this. It's basically whatever you can do, you should do it, and you should do it to the best of your ability.
Thank you very much. And I'd also just like to say, one of the questions in the chat has been a lot of medical staff who have spoken out, have been referred to regulators. I'd also like to draw your attention to the support clinic by the British Islamic Medical Association. You can get it support@britishima.org. They're doing a lot of work as well on that. So next, could I just ask Brother Manib if you've just one action to summarize, how can we support the people of Palestine?
I can't really put it in one action, but I know that my one action as a humanitarian worker is to alleviate suffering and protect lives. And whoever can support in making us succeed in this has a list of actions to do. Continuing supporting, again, being vocal. Again, advocacy is a major part of alleviating suffering, because now we're not able to deliver aid properly. Then we need to raise our voices collectively to make it go through. And definitely the ultimate goal is ending occupation, but the least is complying with international laws that are being kind of like lost in the middle now. So that's what I can say. Yeah.
Thank you. And next, Taib Ali, please.
I think the important thing is like, it might look like what I'm doing with ICJP and my legal career is effective, but it's just the skills that I've got. And it might look like, well, it does look like what Dr. Mustafa is doing is effective, because it is. But he's a doctor, so he's using his skills. The same applies to Ishmael, the same applies to Rizwana, the same applies to all of us. I think for each of us, it's exactly what Dr. Mustafa said. We need to really examine our own skills and look at what we can do. And the very least we can do is be an advocate for the truth and what's important, and make sure that that word is spread. But then look at yourself to see what you can do within your own skill set, with your own profession, and work that out for yourself, and join with others within your community, within your professional groups, within your working groups, within your street. When you hold an event, I hold a Christmas event every year for my neighbors who are all non-Muslim around where I live. And we talk about these things. We talk about Palestine. We talk about what's happening in these places. That's my way of helping them to understand what's going on there. And so I think each of us can find and utilize our skills in the best way that they think they can do that.
Thank you very much. And yeah, important that we're not working in our silos. We're working together as much as we can. Next, Rizwana, what one takeaway that we can have from tonight about what we can do?
One thing I think is, next time you see something that's biased or misleading, just take the time to make that complaint. But the other most important thing is really all of you, once we bring out our BBC report, is to get behind us in terms of the campaign and to get in touch. I've given the email, but we need your help to really make that a very broad campaign when that report comes out. So support that campaign.
Absolutely. And as I said, we will be emailing all the links. So if you haven't got it in the chat, if you haven't been able to take a note of it, we will be sending all these links to everyone, inshallah. And last but not least, Brother Ishmael.
I'd just like to give you an example, maybe, and a real life example. I was recently invited to South Africa to the Teachers Association. And one of the teachers mentioned during apartheid time, he was a maths teacher, and it was apartheid era and they couldn't talk about the apartheid system. Yet he wanted, as a campaigner, this is how he taught his maths. And this, what he mentioned is quite astounding, that he used to give equations in which they, if a white person for a job earned 10 rand an hour, and for the same job, a black person, 5 rand an hour, what was the difference? That example is very important because here was a teacher wanting to teach about apartheid, but he used his medium to get that message to, despite the oppression and the consequences. Each and every one of us here has to understand that we have a medium through wherever our walk of life is, whatever our work is, to make sure that we bring this to the fore and talk about it. And finally, another point, sorry, I'll just take the advantage here, being last speaker, is to make sure when there's a call by any organization for mass mobilization of any sort, please support them, whatever they may be. We need to unite for this, and please get together and make sure that we make our representation. Jazakallah.
So I don't think any of us can leave tonight without feeling that we've been challenged, and without at least thinking of one thing that we can all do. I'd just like to call on Brother Masood just to close for us tonight. As I said, all our links and this recording will be made available, so please share the learning that you've got tonight, and share the information. And thank you very much for joining us.
Jazakallah. Actually, I would like to finish, if you don't mind, Brother Masood, I would like to finish. Assalamu alaikum, everyone. The reason why we did this webinar was because something really dangerous we were noting was happening in the Muslim community, a dangerous narrative. And that dangerous narrative was hopelessness. People, when the genocide restarted, there was a narrative, and you can see it in the questions. What's the point? What can we do? We've already tried this. It's not working. What can we do? We have to try something else. Nothing is working. And we are not allowed to get hopeless, because the people of Gaza do not feel hopeless. They're going from one massacre to another, and they have not lost a single ounce of hope that they are going to, certainty that they are going to be in a free Palestine, that they're going to get their freedom, and they are going to get their justice, if not in this world, then in the next. So how can we lose hope? The point of getting all these people here is to show you there are things that we can do. We can support the charities. So don't listen to this narrative that the aid isn't getting in, so stop donating. That is a dangerous narrative. The aid needs to be ready to go in. The aid needs to be there to rebuild. Don't listen to that narrative that says the aid is not getting in, so what's the point of donating? It's a very dangerous narrative. And we need to help our lawyers. They're holding people to account. We need to use the systems that are at our disposal. I know that we think, oh, the system is rigged against us, but there are those who are experts at using that system, who are able to hold people to account, who are able to put pressure on them. Then support them, resource them, and don't nickel and dime them. Don't ask them for every penny, what did you spend on this or that? Support them because they have a track record and they are producing results. And then you have people like Sisters One and CFMM who are holding the media to account, so support them. Look for them, go online, Google it, and find out how you can support them. When they share messages, make sure it reaches to people. And more importantly, everyone else complains, but we don't. Muslims, we complain to each other. We don't complain to the authorities. We give them no pressure whatsoever. Pressurize them, write letters to them, tell your friends and family to do that. We know how little gets through. We're talking in the hundreds. We have a community of 4 million. How can they have only a few hundred complaints from us? That's a shame on us. So we're not doing everything we can. And finally, as Brother Ismail said, do not give up on those things that we're doing. Whether it's protesting, whether it's boycotting, whether it's lobbying, just because it hasn't worked yet doesn't mean it's not going to work. It's like, that Mandela would have given up. Because he was more than 18 months in prison, he would have given up. But he ended up being president of South Africa. And we see so many examples like that. There were days our Prophet ﷺ and the Sahabas were struggling. And then eventually Allah subhanahu wa ta'ala opened it. But Allah subhanahu wa ta'ala opens the door for the people who persevere, not for the people who give up. So our main job here as Muslim Council of Britain, what are our job? Our job is to tell you that there are many people who are working and we are not allowed to give up. We do not have that luxury and we do not have that option. Allah subhanahu wa ta'ala did not give us that option of giving up or being negative. Be positive, be sure that the victory and be sure that success is in the hands of Allah subhanahu wa ta'ala, not in ours. We have to do what we can and He will do what we cannot. And please, this is just the beginning. There are many more things out there that can be done. But the most important thing I'm going to finish with here is we need to do something that we haven't done for a long, long time. And that's going to be unite. If we unite as a community, then ICGP will not be a project run by some people. It will be our legal arm. And CFMM will not be a project run by some people. It will be our media representatives. And Friends of Aqsa and those who are organizing these protests or the boycotting are not asking us to do it. They say and it is done. That's what unity means. And when we are united as a community in this country, Allah subhanahu wa ta'ala put barakah in our efforts. That is the hardest thing to do. So every one of you who tries to unite two people together, or two mosques together, or two communities together, you are playing your part in helping Palestine. You may not see it, you may not know it, but you are doing it. So Jazakallah khairan for coming to this webinar. Do not lose hope. There are many practical suggestions and there will be many more out there, but whatever you do, do not lose hope, because verily Allah subhanahu wa ta'ala is near. And when Allah subhanahu wa ta'ala is near, then we have nothing to fear. Make dua for your brothers and sisters in Palestine. Make dua for each other, inshallah. And inshallah, we will one day have this webinar again, and when we talk about a free Palestine. Jazakallah khairan. Subhanallah, hamdaka, nastaghfiruka wa natubu ilayk.
Ameen. Assalamu alaikum.
Assalamu alaikum, everybody.
Hey, Jazakallah khairan. Thank you, everyone, and especially our panelists. Assalamu alaikum wa rahmatullah.
Assalamu alaikum wa rahmatullah. Thank you very much.